Good evening, everyone, and welcome to the Bateman Horn Center January Education event. We're so glad to have you all here this evening. Come on in and sit down. It's the dark, dreary days of winter, so we're really lucky today to have Dr. Stuart Drescher here with us to tell us how to overcome those dark and dreary days. Dr. Drescher is a psychologist. He has a full-time clinical practice at a company called Mind Body Health. He provides individual psychotherapy, group work, and education training, meditation training, as well as a bunch of classes. His work focuses on psychological challenges in work, relationships, and personal growth, as well as medical illnesses. He's very experienced with patients in chronic fatigue and fibromyalgia, where he focuses on coping, adapting, and living meaningfully. He's also an adjunct faculty at the University of Utah, where he supervises graduate students. He teaches and lectures frequently throughout the community, and he's been very active in community-based services. He helped launch the Cancer Wellness House, and for 5 years he was the clinical director there. After that, he helped found the Organization for Fatigue and Fibromyalgia Education and Research, OFFER, which was the precursor to the Bateman Horn Center, and Dr. Drescher served on the board of directors throughout that transition. We were very lucky to have him here. He continues to consult with nonprofit health organizations in expanding organizational effectiveness. And welcome, Dr. Drescher.
Thank you. Thank you. This is a particularly difficult time of the year for people with chronic fatigue syndrome and fibromyalgia, because the holidays are a time that draws in to more activity than what we're generally able to handle with these illnesses. The whole concept of chronic fatigue is slowly being better understood as we identify the role that exertion has in the post-exertional malaise that inevitably results. And so when a person has been able to manage the illness for a period of time and hold symptoms at a tolerable level or even start to improve, the holidays come as a tremendous temptation to do things with family, to have fun, in contrast to the limitations that they've been experiencing, and to experience the rituals and the sometimes lifelong habits that have been a part of the holiday period. What results then is a crash that can leave people in bed for weeks or months, and if nothing that severe, certainly a slump in which even getting to work is difficult, or parenting is difficult, or keeping one's spirits up can be difficult. So tonight I want to talk a little bit about that process of recovery and the experiences that we've had in our life apart from this really don't prepare us for the enormity of the impact that these two illnesses can have. The process of recovering from the flu or a head cold, even pneumonia, is something that we think about as taking a matter of days or weeks or perhaps a month. But the exhaustion that can come from chronic fatigue syndrome and with fibromyalgia is such that it sometimes takes a much longer period of time to recover. And it's in that misestimation that sometimes the frustration can become overpowering. So for those people who have actually learned about pacing and have started to moderate their activity levels in accord with what they can sustain, there are some aspects of the Christmas holidays that can really sneak up on people, because the exertion that we're talking about here is not simply from activity, but also from emotion and from cognitive overdoing or challenge. And when we talk about emotions, it can be welcome emotions such as happiness that comes with celebrations, with family being together. It can be difficult emotions like conflict or guilt and not knowing how to manage it all, how to fit everything in. It can be sadness and depression because Christmas in years past has been an unpleasant experience in some families. It can be any number of emotions, and one of the most common is anxiety. There's the anxiety of wanting Christmas to be what we expect it to be as perfect as it might be. The anxiety of fitting things all together in an overcrowded schedule. The anxiety that comes in having family members together who usually don't get along or who have expectations for us that are uncomfortable. And so anxiety is sometimes heightened to the point that alone can cause a crash, even for people who have been pacing themselves. Whether the exertion comes from the emotional or the physical, it might also come from the cognitive or the pure mental activity that comes. And planning can become quite challenging. The process of traveling to be with family can put us into new situations that we have to adjust to. And there's a range of things that we perhaps have done before without any problem, such as driving distances or negotiating airports, that now require greater attention, greater perceptual awareness, being able to distinguish between the important and the unimportant, and so on and so forth. So any of these three domains, activity, emotion, cognitive, can combine in whatever proportion or unique recipe and result in taxing our body more than we're able to handle, more than we've been handling prior to the holidays. So what is to be done? The first thing is to recognize that there's a cause and effect relationship here. In other words, we're not crashing for no good reason. We're crashing because there's been more of a challenge than what our bodies are able to handle. And in a way, it's the metaphor that I use with my patients quite often is that it's like having a bank account. And if you overspend your account, then all of a sudden checks are bouncing, checks are returned, credit cards are bouncing, and we have nothing more to pay with. Also, there are ways in which recovering from overspending at Christmas can be quite a challenge. You know, some families actually get carried away with gift giving and find that afterwards it's time to pay the bill. So, in effect, after Christmas and Hanukkah and New Year's, that's what we're doing, is we're paying the bill. So we need to give ourselves more time for rest. We need to resist the temptation to be drawn into new opportunities and challenges. We need to step back from things that we've been in the habit of doing. And it's not just a matter of getting more sleep, although sleep is a problem with these two illnesses, and sleep can be very unrefreshing, such that even though we're in bed for a certain amount of time, at night we're not getting deep sleep and a restful sleep. But what's required in coming back from a crash, from addressing post-exertional malaise, is an additional measure of just rest. By that I mean having your feet off the floor and doing less, but also challenging yourself with distractions or entertainment less, so that we can actually experience a period of relaxation, a period in which our body can just settle down to a deeper level than it normally experiences. And for those to come in kind of a punctuated pattern. So we start to learn that a certain amount of activity or challenge needs to be followed by a certain amount of downtime, and that alternation continues through the day with some pacing, whether it's 15 minutes followed by 15 minutes or an hour followed by a half an hour, whatever that might be, trying to figure out how to intersperse rest with activity is a difficult thing to explain. It's a difficult thing to establish, but we can start to learn about it, and with professional help sometimes become more accomplished. But the period that follows the holidays needs to be a time in which rest becomes our most important use of time, or the chronicity of this will just stretch out and stretch out and stretch out. So having given you just kind of a brief overview, let me ask if there are some questions that you have that I can address. And I'll tailor my remarks a little bit to what people's particular interests are.
So probably interested in a little bit more about the pacing, but also how the seasonal affective disorder or the sun can
That's a
play
really
part?
good, yeah.
Will you repeat the question?
So the question was not only about pacing, but seasonal affective disorder. And the phenomenon, which is sometimes known by the acronym SAD, or SAD, which is kind of apropos, has been identified and verified by scientists. It's a very real thing, and it has causal factors that we understand to some degree, but not completely. It affects people in northern regions more than closer to the equator because of the short days. The days not only get shorter in Utah, but with the cold weather, people tend to stay inside more. And so between the two of those, there's just less chance to get sunlight, which is very important in maintaining a balance in our moods. So what can be done? Well, one thing is to get out as much as possible, and in a place like Salt Lake City, where the inversion during January can be quite severe. Driving up out of the valley to a neighboring town and just having lunch at an outside patio, or going for a walk on the streets, or going to ski, or whatever you might be doing, gives you a valuable amount of sunlight, even if you're only doing it a couple of times a week. Vitamin D levels play into this, and for people who are affected by seasonal affective disorder, I encourage you to have a blood draw that can assess that, and taking supplements is an important part of the treatment regimen here. And probably the most important thing is to get some full spectrum lighting in your indoor living area, both at work and at home. Different types of lighting, whether it's fluorescent or incandescent, have different light wave patterns, and standard lighting doesn't give us that full range that sunlight does, and so is incomplete. But you can buy full spectrum lights over the internet at a few places here in Salt Lake or wherever you might live, and either buy a box or create something with a standard fluorescent or incandescent socket, and place it on a desk or a work area, and also to find places in the home, perhaps in the kitchen or whatever, where you can get at least 20 minutes of that at the bare minimum twice a day. And that can be really helpful. There's some research that shows that meditation can be helpful with SAD, and the research on that is developing slowly, but I see that in my clinical practice. So it's not something to be taken lightly, and oftentimes people find that with the advent of spring, their mood naturally improves, and this is why. Does that address the question? Are there any specific aspects of that that you'd like to have me amplify?
That does answer the question. I guess I've wondered how effective that is with the chronic fatigue fibro. I probably have tried it in the past, but I guess I'm kind of answering my own question too. It probably is a piece of the puzzle and not the whole puzzle.
Exactly.
So when I try it, it's hard sometimes to tell how effective it is, because you might be doing the exertion massage with it.
Yeah. So while the idea that chronic fatigue syndrome is just a form of depression has been thoroughly disproven, I have to say that chronic fatigue syndrome is enough to make somebody depressed. And so not only is there a natural possibility that the limitations that the illness imposes, and this is true of fibromyalgia as well, that the limitations can contribute to depression, but also the fact that we're more limited in our activity, and so we're more likely to be indoors and not getting sunlight and not getting exercise. So that really contributes to the SAD. And then the SAD kind of compounds the depression. You know, it's all kind of a soup, if you will. But what we can do is to try and address depression through therapy, examining, you know, the way that we're reacting to all of this. In other words, can we find a positive outlook on life, or are we simply overwhelmed by all of the limitations that we're facing? It's like a tossed salad, kind of hard to pick apart. Other questions?
I'll have some questions from here that
Yeah.
are coming in online.
Yeah.
If you'll repeat the questions, can you hear me, Tony? Okay, one question that we have coming in from a viewer online is, any thoughts on how to communicate with family and friends about pacing?
Yes, that's an excellent question, and it's a difficult topic because when we talk with family and friends about limitations, people naturally look to their own experience for what it is that we mean or what it is that we're saying, and so when we say, well, I can't do as much as I usually do, then they're thinking of maybe going to bed an hour earlier, or doing a few things, refraining from doing a few things. And it's very difficult for people to really get the extent of it, the impact of it. And so rather than using broad phrases, we need to be able to talk in terms of specifics. So, for example, we might say, I'd love to go shopping, but usually after about 20 minutes, I feel like I could fall over. Or, yes, I'd love to do that, but I'd have to be in a wheelchair in order to do that. Or a real common one that is dealt with over the holidays is that a person finds that a family gathering with 10, 12, 15, 20 people is just too much stimulation. And so they might need to say, I can enjoy people's company if I'm with one or two or three or four people, but when I'm in a group, I feel like I'm just melting into a puddle because it's overwhelming. So if we can take an example either that the person is suggesting or might be imminent and use that to provide the context for what kind of physical, emotional, and cognitive reaction we're going to have, then it starts to scale for them. And one thing that's oftentimes not well described with chronic fatigue syndrome is the cognitive impact. And as people become overstimulated, sometimes it's like losing your ability to discern or to reason. And so there are people who will go shopping and not be able to remember where the exit to the store was. And some of these things are almost unimaginable to the listener. And so the initial reaction is usually one of disbelief or discounting. And understanding comes only as we're giving them explanations over a period of time. And so it's easier to try and educate family members and friends than it is casual acquaintances or people that haven't had ongoing experience with us. And we might want to find a way to just kind of give a less descriptive answer if we think that this is going to be the only time that we'll be talking with them, because they're just not going to get it. But because family and friends are relationships that continue and have some importance to us, then we need to find ways to put it in terms that they can understand.
So one thing I find is hard is that I feel like I can be fairly normal, at least to the untrained eye.
Yeah,
I
you
can be
look
normal.
you look so normal.
Right, I can be normal, I can even be dynamic in
Mhm.
a public setting for a short period of time.
Yeah.
So I've started to kind of explain it on a cell phone battery, which
Okay.
is, because I don't have a full day charge.
Right.
For 2 hours, all my apps will work.
Yeah.
And then my video app will stop working, and a few of them won't open,
Yeah.
and then at some point, the phone is dead. And I don't have a full day's charge. Because it's hard, I think, when I'm with, especially in a public situation, when I try to be on
Yeah.
and try to get some energy in my conversations,
Yeah.
that people just are like, you know, you're fine, you're dynamic.
Yeah.
You know, they don't understand that that's not a full day of being able to do that, you know, you go home and, as we like to call it, crash, or
Yeah.
become a couch potato for 3 days after your dynamic hour,
Yeah.
so.
I think that's a great metaphor, and if we can find a metaphor that is widely understood or perhaps peculiar to the person that we're talking to, that oftentimes goes much further than the actual detailed explanation. And this is an illness where people don't look gaunt and haggard or pale-skinned or become flat in their mood necessarily, you know, and so it's very bewildering to people who are trying to put together what you're saying and what their immediate impression of you is. And when we feel like we can barely stand up, that's not when people see us. You know, we're 2 days into that 3-day period that you mentioned. Well, there's nobody there to kind of experience us in that case.
Yeah, I've often wished I had purple spots that got darker, that were,
Yeah.
you know, so there was something visible.
Yeah.
That people could tell where you're at.
Yeah. Question? Okay.
Are you ready for another question
Yeah.
from an online viewer?
Yeah.
She says she finds it hard to pace. I feel like I'm always in a crash. What's the best way to pace?
Well, this is a common, if not a general experience, because pacing comes in direct contrast to our natural emotions. You know, we get interested in things, and so then we become more active. We're curious, we're excited, we enjoy a sense of accomplishment. We want to be with other people enjoying their company. We feel best, or we used to feel best when we could just move our bodies and be active. And so the way that we've been living our life is usually complete with a range of emotions that makes pacing the last thing in our mind. And with the patients that I'm working with, I generally am encouraging them to develop more mindfulness of their experience and their situation, sometimes learning mindfulness meditation or being more self-reflective, and seeing that relationship between our natural emotions and then our responses to environmental opportunities. And we need to be able to, at the same time that we're being pulled to do something, be able to think that this might be beyond the capacity that I have right now. And I need to make a choice that is reflecting my long-term commitment to getting better and getting well, as opposed to what the short-term, the immediate, can bring us. And it helps as we start to see our cyclical behavior of getting better and then feeling worse, getting better and feeling worse, superimposed on some kind of life experience pattern, so that we can see that cause and effect relationship. And it's usually that that is an important part of kind of bringing home the necessity of being patient and tolerant of this illness. I think that acceptance is at the very core of healing in this regard. And this is the last thing that most people would want to have happen to them. And yet only when we're accepting that it is our reality can we make choices that are contrary to what we would normally choose to do in that situation. And I think it's the emotional engine that really makes pacing difficult.
Okay, another question from an online viewer. My neurologist says I need physical therapy, but my body doesn't work on a schedule. I frequently have to cancel appointments. Do you have any advice for me?
Yeah, that is a tough one, because people with chronic fatigue syndrome not only have trouble getting in for physical therapy, but for dental appointments and everything else. This isn't about avoidance. This isn't about a lack of commitment. This is simply a matter of limitation. So there isn't an easy answer to this. If you happen to have a relationship with a physical therapist already established who kind of understands the situation a little bit, they might be able to emphasize things that you can take home with you as opposed to things that you need to be in the clinic for. And so even if you're missing appointments on a frequent basis, you still have something that you can work on. While physical therapy is sometimes very useful with fibromyalgia, with chronic fatigue syndrome, it's oftentimes less useful, particularly if the PT isn't very knowledgeable about the illness. Yoga can be a way of stretching the body and gaining some activity that is not as focused and challenging as the PT exercises, and is oftentimes something that can be done at home without supervision once you've learned a couple of asanas and been supervised in that learning process. It can be a self-sustaining activity quite easily, and so that one might be something to consider. Yeah.
We actually found a dental hygienist who will come to your home and will
Wow.
do an appointment there. I gave the name to Dr. Bayman
Okay.
and her contact information. She works at the dental office where we go to, and she just recently got her license. She's the only one, I believe, in the state of Utah who has gotten a license to be able to go into people's homes and do dental hygiene.
That's marvelous. That is marvelous. And finding those kinds of people in all areas is important. Having a hairstylist or a barber that can come into your home. They're a rare breed, but if through networking you can identify some of those people, it makes all the difference in the world as compared to having to get up and out and travel and then sit and wait and deal with all of the stimulation that's involved in that. Yeah. Another question.
Do you have any
Do you have any advice for caregivers or family members, what they should be looking for in a person with ME/CFS or fibromyalgia so they can help stave off the crashes?
Is the question about whether a diagnosis is accurate, or whether, or just helping the patient manage?
Helping a patient manage, what should a caregiver or family members watch for
Okay.
so that they can help?
Okay. A person who is experiencing rather pronounced fatigue symptoms rarely can predict what they're going to be capable of tomorrow or next week or in 2 weeks, and will fare best in a day-by-day approach. And so if a person can get up in the morning and think, all right, I have enough energy, I can do one thing, or I could do this as long as it's not too big of a group, or if I don't have to do too much traveling or whatever it is, then that particular activity is less likely to be too much of an exertion than if it's a commitment that's made to in advance. Now, that's not the way our culture works. And families are part of the process of, creating those plans. And so caregivers oftentimes are most valuable when they can just say, well, let's just see how you're feeling when we get to that point. And in doing so then helps take some of the pressure off of the person to give an answer that they're really not prepared to give. And sometimes it means that the caregiver and the family needs to be prepared to go ahead with their plans, even if it can't include the patient. And how that's handled between the caregiver and the patient, is very important to reassure the person that their good wishes will be extended, when the visit occurs, or that they'll bring back stories that are part of the gathering, or whatever it might be. So the caregiver, if he or she is anticipating being able to read the tea leaves, and tell whether a person's going to be capable of something or not, is expecting too much of themselves, So we have to rely on the person to actually say what they're capable of or not capable of. But the caregiver can be really helpful in creating that more spontaneous and permissive and supportive environment in which the person can try and tailor their activity. Yeah.
What are some signs of SAD for a caregiver to look for in someone who has ME/CFS?
Well, what are some of the characteristics of SAD, seasonal affective disorder, that the caregiver can look for? And this goes to, I think, the general issue of depression. And depression is a term that's misused often in people when they're feeling discouraged, or any number of emotions that aren't welcome. We'll refer to that as depression. But depression is really the lack of emotion. It's when our affect becomes flat. It's like having somebody throw a wet blanket over our whole emotional being. And so the caregiver is looking for not only that flatness of emotion, but a lack of initiative, motivation, or desire. And you know, that's the real tragic thing I think about chronic fatigue syndrome, is that at the same time that a person has so little energy to do anything, for the most part, their desire, their interests, their enthusiasm is where it has been, you know, throughout their life. And it's that gap that makes this illness so hard. And when when I receive a referral for the purpose of diagnosis, it's very easy for me to distinguish between somebody who's depressed or somebody who has chronic fatigue syndrome, you know, because the person who's depressed, when presented with an opportunity, will say, eh. And the person with chronic fatigue syndrome will say, yeah, you know. And so as a person that has chronic fatigue syndrome and has some of their normal enthusiasm becomes depressed, then you see that drop in motivation and initiative that's contrary to how you've known that person to be. Does that make sense? One of the things that I work with my CFS patients a lot is shifting their thinking pattern from what they can't do to what they can do. And as long as we're constantly having thoughts and ideas about things that normally are engaging us, and then pulling back because we don't have the capacity to do it, there's a deficiency, there's a deprivation in that is sometimes even paralyzing. But as we start to accept that this is our physical reality and realize that the illness hasn't taken everything from us, then if we start to think, what can I do? Then we're more likely to be able to have that thought about something, and our energy level fit more closely, you know. And so there's a fellow who's an outstanding painter who, with chronic fatigue syndrome, has not been able to be as prolific as he has been in the past. But with time, he was able to find out that he can paint for 15 or 20 minutes at a time, as opposed to for a couple of hours as he used to. And if you're only painting for 15, 20 minutes at a time, you spend most of it cleaning your brushes. And so he shifted from oils to watercolor, so that cleaning the brushes wasn't the main activity, but he could actually spend most of that time painting. People with strong cases of chronic fatigue syndrome oftentimes can't concentrate over a period of time and read a novel or technical materials is impossible, because you just can't follow the logic, the informational thread as you did before. But poetry is something that can be enjoyed, you know, in shorter amounts, or perhaps short stories. And so if reading has been your greatest pleasure, rather than giving it up completely, asking yourself, well, what can I enjoy? And maybe it's magazines, and magazines that are written with shorter pieces rather than longer pieces. So there's a challenge in getting past that deprivation mindset with this illness. And the same is true of fibromyalgia, because the pain can sometimes really limit what we can do with our arms or our ability to sit or stand in various postures for very long. And in either case, we're looking to see what capacity we have rather than what capacity has been taken from us.
Another question from an online viewer is about diet. Do you find that your patients are more successful with special diets, such as a ketogenic diet?
Well, I'm not a nutritionist, and I'm not therefore in a position to address specific diets. For some people, adjusting their diet can be more of a beneficial impact than it is for other people. And we don't know why that difference occurs. But if you can become more attentive to what you're eating and then how you feel in the hours afterwards, you'll start to learn something about foods that aren't favored by your body, and that can either lead you to make adjustments yourself or take those recognitions and compare them to some of the well-known diets that are out there and the books that are on the market, or to see a nutritionist. I would encourage anybody with either of these two illnesses who suspect that there's a dietary component to seek out a nutritionist. It's very well worth your while. One or two more questions, or okay? And from, okay. Well, I'm glad we've had the chance to talk tonight about this. I've had a patient who, much like your remark about purple spots, say that she wished that her nose turned purple and became long, because then at least people would understand that something very real was happening to her. And I think there's a similar, more obscure phenomenon that happens where people just disappear from their social networks for about 2 months. And where did so-and-so go? I haven't seen her since December, and it's March, you know. The response to the holidays can be so impactful that it sometimes just takes us right out of the game. But it's not inevitable. And to the extent that you can tailor your experience of the holidays to what you're really capable of, and to the extent that you have understanding people around and caregivers that can be helpful, then the holidays are less of a devastating, though desired, event. And for those of you who have been really hit hard by this, I would just encourage you to be compassionate for yourself and patient with this progress, and try and take good care of yourself until you feel like you are able to get back into activity a little bit more than you will in the meantime.